Hello friends, my name is Dastagiri, a volunteer from India Gives Foundation. We are going to discuss mental health concept today. Before proceeding with the presentation, I would like to have a disclaimer. This video is knowledge purpose only. Please contact respective professional for your mental health support. So what is the mental health in India? Usually in India, whenever a family member gets any problem, there were grandmas, parents, siblings who can support you emotionally and financially. So now the world is changing. So we need to address this mental health, because if you don't have mental support from the family, and you definitely feel lonely, right? So government of India is also taking so much of measures to address this, but there are certain policies should be addressed to bring lot of medical resources and assistive resources to address this illness. So I was going through certain journals or some articles in the internet. I could found some statistics which are very interesting, but that will be very subject to correction because by now it might have changed. But what I could found is mental health in India is still a fairly new topic, and mental health myths and taboos attached to this subject are prevalent to this date. According to the National Health Program by the Ministry of Health and Family Welfare, 6% of Kerala's population has mental disorders. 1 in every 5 has some emotional and behavioral problems or the symptoms they are addressing. Close to 60 to 70 million people in the country suffer from common and severe mental health disorders. India is the world's suicide capital with over 2.6 lakh cases of suicide in a year. And World Health Organization statistics says the average suicide rate in India is 10.9 for every lakh people. Today when I was searching it, it was showing 12. Very sad. There are a few factors and reasons that contribute to the mental health illness and its care, which is rising this number, because there is an ignorance in the people. The people use the words like mad and asylum carelessly. So the people will feel very shy of it, and also they feel it is a big disease. So they tend to not to disclose their mental health problems with others. So that is also one of the reasons they don't get proper treatment on time. And the second case is the lack of help. Why I'm saying the lack of help is, whenever there is a problem, there should be people to address it. It may be medical health resource, it can be assistive like doctors, nurses, and proper advertisement about the diseases in the communities, like that. What I found is we have just 43 state-run mental health institutions across the country, 3,800 psychiatrists available for the requirement of 11,500. So we need 11,500 psychiatrists, but as of now we have 3,800 psychiatrists. And we need 17,250 clinical psychologists. As of now we have 898 members only. So 850 psychiatric social workers, where we need actually 23,000 social workers for the psychiatry. So we need 3,000 psychiatric nurses. As of now, we have 1,500 nurses. That means there is only one psychiatrist for 4 lakh Indians, and only 1022 college seats for mental health professionals are set aside in India. So we should think of it, because in the earlier stages there were no mental health issues from India, it was very minor. But due to this globalization and modernization, it is being increased. It may be due to relationships, or it may be due to family issues, or it may be due to some other reasons, or it may be due to some addictions like social media addictions and drug abuse, these things. The final reason is no insurance for the mental health illness. So many insurance providers are available. So majority of them doesn't provide insurance for the mental illnesses. So if the patient wants to get a good treatment in a good hospital, so the fee might be bigger than what their income is. So in that case, if the insurance also provides some support, they will get better treatment in the better hospitals. So thank you, friends. This is all about our mental health in India and its statistics, what I found in this, and these numbers may be subject to correction.